Hello, everyone, and thanks for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, and tonight, just like every night, I will try to get to as many questions as we possibly can. But first, I want to say hello to Dr. John and Mary McDougall. Mom and Dad, how are you?
Well, we're just fine. We're in the middle of a 12-day program with some great people.
We are.
So we're having fun. Just gave them the lecture on cancer, which they all thoroughly enjoyed. Which it's kind of shocking for people when they discover the real truth around cancer and the fact that it's natural history. But you understand the natural growth, the natural history of cancers. You no longer are living in a world of hopes and dreams. So, we talked about that, the group did.
Yeah, so last week we were just kind of starting our 12-day program, and now this week we're ending it. We have a couple more days left.
Right. And we've got.
I thought it would be good to start out, Dad, since you brought up cancer, talking about the latest recommendations from the U.S. Preventive Services Task Force, lowering the age of mammograms to 40.
Right.
I know what you think, but let's hear it.
Well, one thing for sure, we'd all agree, you've increased the market tremendously. You now included another 10 years of customers, right? Think about it. I mean, just think about it for a minute. If you recommend that women start at 40, you've included millions more women who need mammograms, which you up the many billion-dollar a year business. But regardless of whether it works or not, it has an economic advantage to it, and you ought to start by thinking that could at least be part of the motivation, since cash is king. It is in every other business. So that's, I think, the primary driver, Heather, because I know mammograms are overrated. And what I would give you for the evidence is the head of the Cochrane collaboration, Peter Gertzke. If you look on our website, he's probably in the McDougall channel, but shouldn't be too hard to find on YouTube. Look up Peter Gertzke, or look up McDougall and mammograms. And you'll find the interview I did with him. He was the head of the Cochrane collaboration for over 20 years. The Cochrane collaboration is the most unbiased organization of researchers in the world. They put out Cochrane Reviews, which is where an expert scientist takes a look at the data and then comes to conclusions. So the rest of us peons, general doctors, have an understanding of what's going on. Because I don't have time to read all the papers, except when it came to mammograms. I had enough time to do that. So anyway, Peter Gertzke, the head of the Cochrane collaboration, he wrote a book, Mammography, Truth, Lies, and Controversies. Write it down. Mammography, Truth, Lies, and Controversy. You can go to Amazon when we're done here, and you can look that book up and order. I think it's $60, so it's not cheap. Don't read it unless you're an expert. And the reason is it's very complicated, very technical. I asked Peter if he wrote it himself, and he said he did. Didn't have any help. But, for somebody like me who happened to live every one of these studies, I was in my career, my medical career, when the Malmo study came out, the New York study, all the different studies came out in terms of mammography and whether it helps or not. The Miller study from Canada, et cetera. These are all things that came out in my medical career. Well, I enjoyed Peter's book because he reviewed something that I had been interested in for my whole career. That was what it was, mammograms. And Peter Gertzke will tell you that mammograms does not save lives, increases the number of women overdiagnosed with breast cancer, and increase the number of women who get mastectomies. The Cochrane collaboration, the Cochrane Review, Cochrane collaboration, the big group, 150 countries, at least 30,000 members. They put out in 2012 a brochure that went out to different countries in 13 different languages that told women to stop getting mammograms because getting a mammogram does more harm than good. And I'll stand up against anybody who wants to argue otherwise. And we can talk study by study, et cetera, and what the results are. The reason that mammograms don't save lives is because it's a crude technology. It was devised by Wolf. I was actually a medical student when the first mammograms came out. I remember going into the X-ray department and seeing the first mammograms ever done. Anyways, it's a very crude technology. You're looking at the breasts through an X-ray exam, and you're looking at tumors that may be bigger than a half an inch, certainly not smaller than a quarter inch. And what you need to understand is by the time you get to a tumor mass that big, the cancer's been growing for 10 years. You see, if you understand the natural history of cancer, which is what I gave the lecture on to our 12-day program group, if you understand the natural history, what you'll understand is that cancer starts as a single cell, say in the breast or in the prostate, or even in the lung or brain, starts as a single cell that becomes damaged. It becomes damaged and stops obeying the rules. The rules are you can't divide anytime you want. The reason is if you divide it anytime you wanted, you become a misshapen lump in a matter of a day. You can divide when you're growing. You can divide if you're going to repair a wound. Otherwise, cells can't divide except at a regular rate. Once they become damaged, they start dividing at their own regular rate, which is every 100 days they divide. Otherwise, normal cells usually don't divide. They have actually 52 doublings in a lifetime, but I don't want to get into that. Anyway, they divide every 100 days. So you get cancer in a breast that contains 100 billion cells in one breast. And 100 days later, 3.5 months later, you've got 2 cells. And then another 3.5 months later, you've got 4 cells. And then at the end of a year, you've got 8 to 12 cells lurking in a breast that contains 100 billion cells. At these stages, the tumors, the cancer cells will break loose into the venous system and spread to the liver, lungs, and bones. And that's the cancer that kills, that metastasizes. So you go back to the original tumor in the breast. 1 year of development, 12 cells. You keep the divisions going, and finally you're at 6 years of growth. It's been growing for 6 years. It is the size of a lead tip of a pencil, a period on a paper. It's 1 million cells. It's a millimeter in size. It can't be found by any technique, much less mammography. The divisions continue, and you go from 6 to 10 years. Now it's a detectable size. The smallest lump tumor that you can diagnose by feeling and by mammography, maybe a little bit smaller by mammography, but by feeling, is a tumor that's a centimeter in size. It's the size of an eraser of a pencil. It contains 1 billion cells. It's been growing for 10 years. Now, I say mammography may find smaller tumors, but they find them later in the cycle. Think about this. The large tumors that grow fast, a woman finds herself. So maybe at 6 years or 7 years of development or 5 years. The slower growing tumors are the ones found on mammogram. They're found after they've been growing 14 to 17 years. That's what the research says. So you had a tumor growing 6 years, 10 years, 17 years. It is spread, ladies and gentlemen, if it's going to spread. How in the world would intervention of any kind help? Or at least any local treatments like radiation and surgery, they don't help as far as survival is concerned. That was proved by Bernard Fisher in 1975. And in 2002, they published their 25-year studies that showed no survival benefit, no matter whether you cut a woman's breast off, whether you did a lumpectomy or radiation, the survival is the same. Why? Because it's an old disease by the time you find it, even by mammograms. In fact, it's even older. It's money.
But, nobody wants to hear that.
No, I suppose you like to hear you find it, you cure.
Nobody wants to hear that it doesn't matter when you find it. It's already been growing for a long time.
Well,
everybody wants to hear, oh, they found it early, I'm going to be cured. And they all believe that.
Yeah, except for the women who are on their deathbed from breast cancer, who've spent their entire fortune, their retirement, everything they've spent on radiation, chemotherapy, and surgery that didn't add a day to their life. Then they're mad. Or if you hold out for a mammogram to save you, you're less likely to eat a starch-based diet to save you. Oh, I don't have to eat those potatoes. No way. I can eat steaks and ice cream sundaes. I'm going to get saved by the mammogram. I'll just go for the mammogram. So that hurts those people. You're being lied to. You're being cheated. If you don't want to meet with me, you can meet with Peter Gursky. I'll make the arrangements. And you experts who recommend this can come out and deal with the two of us. Did I say that to the public around the world? Oh, man, I just might get challenged.
I doubt
I doubt it.
So then we're wondering, people are writing in, so what can they do? So Daniel's writing in, his mother was diagnosed with liver cancer, and the doctors say there's nothing that they can do because it's already spread. What would you recommend she does?
But Heather, it's spread when it's a year in development or 2 years. You know, by the time it's been growing for a year, or certainly by the time it's growing 6 years, when it's a millimeter in size, a million cells, it's spread in over 90% of the cases if it's ever going to spread.
Yeah, but
But a lot of times it doesn't spread.
what I think this person was referring to.
It's how do you find it?
No, what happens to people is they find the cancer, or their doctor finds the cancer, and they sort of blame the patient. Like, well, it's too late.
Oh, you should have checked.
You
You
can't
should
do
have done
anything
more.
about it because now it's spread and it's way too late.
Did you get your mammograms?
Yeah.
Did you do breast self-examination?
Well, see, that's it.
Excuse
They're
me.
making the people feel bad.
Excuse me, the Canadian Preventive Task Force, the official organization that makes recommendations to Canadian citizens about their health and medical care, the Canadian Preventative Task Force on Medicine, in 2001, that's 22 years ago, they told women to stop doing breast self-examination. In the year 2010, the U.S. Preventative Services Task Force told women, that's the U.S., the same ones that are advertised to do a mammography. They told women in 2010 to stop doing breast self-examination. Why? Because by the time you find the tumor, it's too late, and you're finding a whole bunch of things in your breasts that would have never threatened your life, but now you're in the business. Now you've got to have more and more tests, more and more treatments, more and more surgeries, or they might diagnose you with a cancer that never showed up in the rest of your life, and they throw the whole kitchen sink at you. You get the surgery, the radiation, the chemo, and it never was needed. You were overdiagnosed. Why did the U.S. Preventive Service Task and the Canadian Preventive Service Task Force on Preventive Medicine tell you not to do breast self-examinations? Look it up. It's because it's too late.
And they scare people so much that once they get cancer, the poor people think they have to do everything.
All right. You've never heard this before, Heather, but I'm going to tell you. Now, you've heard it before because I showed it to you at one time. There was a magazine, not a journal, but a magazine that was put out by the medical businesses that said that we ought to do removal of breast buds at the time of little girl's birth, just like we do circumcisions on little boys. Excuse me. In other words, a little girl baby's born and you take her breast buds out so she won't get breast cancer. That appeared in print. Like we take little boys' foreskin off when they're born with a circumcision. That's how enthusiastic these people are. Yet, most of them won't deal with the real cause of breast cancer and the real treatment, even a treatment that has been shown to slow the growth, to keep people alive longer. February 13th, 2015. You want the date again? February 13th, 2015. The American Cancer Society came out with their recommendations that said that doctors who are treating cancer patients need to include as a fundamental part of their therapy a diet. I didn't say this. They said a diet of fruits and vegetables and whole grains, but a diet in the direction that McDougall's are teaching you. In 2015, February 13th, American Cancer Society, look it up. So, you change diet. all these tests and treatments, they're multi-billion dollar, $10 billion a year in business. And you include a group 10 years younger, you just upped it by a couple more $1 billion. Get real. But they have the media's ear.
Now they do.
So there's a lot of money involved, ladies and gentlemen. It's all money. It's nothing else that's going on but money. And if it was, a conspiracy theory, they'd give it up for money. You pay them a few bucks and they'll tell you the truth.
Okay, you ready to move on to another question?
Yeah, I wasn't going to answer that last one for you, Heather, but you got it out of me.
I know. Well, I thought it was important. Okay, next question. This comes from Nico. He and I have been communicating by email, and he's got very stubborn blood pressure. He's trim body weight. He's been following the diet perfectly. And he and I have been going back and forth about what he should be eating. And his blood pressure is just being stubborn at about 140/90. What would you recommend to someone like that?
First, that is not a very bad blood pressure. The National Health Service of Britain, since 2004, have recommended that we not initiate drug therapy unless the blood pressure is sustained at 160/100 or greater. So he doesn't meet the British criterion for starting blood pressure medication. The Cochrane collaboration, Cochrane, I just talked to you about that. They say that you can't find benefits in treating a blood pressure of less than 160/140/100/90. No evidence, no benefit from treating blood pressures that are that level or below. The American Heart Association, their recommendations that just came out say that you shouldn't start blood pressure medication on somebody my age, over 60, I'm well over 60, at my age, unless the blood pressure is sustained at 150/90 or greater, like greater. So first of all, whether or not you have a blood pressure level that's high enough to be concerned enough to put medication involved, you don't. All right. Second of all, I want to make sure you check your blood pressure under proper conditions. That might work out with you sitting in a still room, relaxing, a blood pressure cuff that works, et cetera. There are also ambulatory blood pressure cuffs that your doctor can attach to you. You walk around or check your blood pressure without even you knowing it. I know you probably might notice it, but several times a day you get your blood pressure checked. That would give you a more accurate reading as to whether your blood pressure is up or not. Most people's blood pressures go up naturally when they get frightened, anxious, they're in pain. White coat syndrome, they go to the doctor, their blood pressure goes up. That's why your blood pressures in your doctor's office should never be taken of any value. It's because you're scared. You went to see the doctor, you're frightened. Why shouldn't you be? Anyway, so I'd make sure the blood pressure is checked under a proper circumstance. I would relax as far as having really high blood pressure. At most, you got what we call mild hypertension, even if the values you get are correct. And then I would think about what you want to do. William Clifford Roberts, who is the pathologist for the National Institutes of Health, William Clifford Roberts, he was a previous friend of mine too. He wrote an article that was titled something to the effect, are there 10 risk factors or just one when it comes to heart disease? Okay, 10 risk factors like age, cholesterol, body weight, blood pressure, he listed 10 factors. But he came to the conclusion that cholesterol was the most important risk factor as far as predicting your chance of having a heart disease. If you had a normal cholesterol below 150 milligrams per deciliter, he listed as normal, then age didn't count, blood pressure didn't count, nothing counted except the cholesterol. So he said there's only one factor. So look at your other rest of your health. Blood pressure is just one factor. Look at your body weight. Look at your cholesterol, your triglycerides, your blood sugar. You get a better picture of your future risks. It's just a prediction factor. It's predicting the future of your blood pressure. It is not. Nobody dies of high blood pressure. Nobody dies of high cholesterol. Nobody dies of high blood sugar. What do they die of? They'd have strokes and heart attacks, rotten tissues. These are just signs of disease that we can stop down with drugs. I'm very good at making your signs go away. I'm a doctor. I got a prescription pen. I can make your cholesterol 20. I can make your blood pressure 40/15. I can make your blood sugar 3. I can do that. I'm a doctor. But can I make you healthy? I can't. I can tell you how to get healthy, but it's what you have to do yourself. You got to fix the problem. And the problem's the food. All right. The last statement for this gentleman is that if you're really concerned and you really think you got an issue, which so far I'm not convinced of, you'd follow the Kempner program. Walter Kempner, the rice diet, fruit juice, rice, and table sugar. Okay, white rice he served, fruit juice, and table sugar. He basically was Duke University for 7 decades. He financially supported Duke, in Durham, North Carolina, for 2 decades. The rice diet. They were the financial support for that institution.
The fruit was cooked too, right?
Yeah, I don't know. Why not?
Really?
That's
I thought
elimination
you told-
diet.
No, I thought you told me Kempner had
Cook
cooked
fruit?
fruit.
I don't know. I don't think so.
Oh,
Fruit.
okay.
How do you cook fruit juice?
Well, you don't cook.
How do you
fruit
cook table
juice.
sugar?
No, but I said fruit.
No, I
didn't say
think
fruit juice.
you're. Wait a minute. I think you're getting my elimination story mixed up with my Kempner story.
No.
All right.
All right.
Well, I made a mistake then because it doesn't have to be cooked.
Okay.
All right, forget it. Anyway, Walter Kempner has published, very valuable research in the best medical journals available. His results on malignant, morbid, deadly hypertension, which is when you run a value where the top number is 200, 220, 240, and the bottom number is like 120, 140, 150. These people, they have horrible rates of stroke, heart failure, they die with those levels. So at one time, when Walter Kempner was the thing for the world, because they didn't have the drugs yet, they had the rice diet. And he got 60% of the people with morbid hypertension down to normal with the rice diet. Now, once they came out with drugs like diuretics, people didn't think they needed this low salt diet anymore. So they abandoned food and picked up drugs. What do you think? All right. So that's what I would do. I think the last effort you should make is to do the Kempner diet or something close to it. At least the salt recommendations, which are morbidly low, less than 500 milligrams of sodium a day. You had to wash the rice to get the salt off. That's what he used to do, whether it worked or not. Walter Kempner was so fanatic about sodium, less than 500 milligrams, fewer than 500 milligrams of sodium a day. Yeah. Our diet is 500 milligrams of sodium. You add a half a teaspoon of salt to the food, which we recommend you do, just for enjoyment. A half teaspoon of salt is 1,100 milligrams of sodium. So you add 1,100 to the basic 500 that our diet is, you're up to 1,600 milligrams of sodium a day. If you have a massive heart attack, you end up in the intensive care unit. Their low sodium diet is 2,000 milligrams a day, which is 400 more than ours, with a half a teaspoon of salt sprinkled on the surface. So, otherwise, unless you go to the extremes of Kempner, low sodium diets basically are useless. Tiny drops in blood pressure. Top number drops about 3 to 6 millimeters of mercury. Bottom number drops not at all, or maybe 3 millimeters of mercury, by dropping your sodium intake by 1,750 milligrams down to 3,500 milligrams a day. No, from 3,500 milligrams a day, drop it by 1,700 milligrams down to 2,300 milligrams a day. Forget it. You don't care whether I get the numbers exactly right, do you? Forgive me a little bit.
Okay, well, thank you for that answer. I think you'll make Nico feel a lot better about his blood pressure because it's just a number.
All right.
Okay, next question. This is from Baby A. When trying to reverse type 2 diabetes and eating plant-based, can you get daily morning blood readings that are high and sometimes normal, but eventually get a low A1C?
Is the question, can you eventually get a low A1C by having?
I think by having, not great sugar
It's
readings.
well, depends on if it's better. If the blood sugars are generally better than they were before, you're going to get a lower hemoglobin A1C. Hemoglobin A1C is you take the hemoglobin molecule, which is what holds on to the iron in the red blood cells, the hemoglobin. It's a molecule that has all kinds of twists, and it's like a spaghetti noodle all twisted up. That's what the protein looks like. And what happens is if you have a lot of sugar in your blood, a lot of sugar is attached to this protein. And the percentage of sugar attached to the protein is the hemoglobin A1C. When you attach the sugars to the protein, you distort the proteins. So that's part of the reasons diabetics are weakened people. They are metabolically handicapped because their proteins throughout their body are coated with sugars. Anyway, hemoglobin A1C is considered normal at, say, 6%. I don't want to argue about the number. Let's just go with 6%. If you have, and what it reflects is your blood sugar over, say, 3 or 4 months. So if you daily run blood sugars better than you did before, over the next 3 to 4 months, the hemoglobin A1C is going to be improved. I thought the question was coming, what if I do everything you say, Dr. McDougall, and I'm trim, and I still have high blood sugar? Well, then you don't have type 2 diabetes. You have something in between type 2 and type 1 diabetes. You've got type 1.5 diabetes, which is partial pancreatic insufficiency, some insulin resistance, so that you don't make enough insulin to make your blood sugar normal, but you make enough insulin to keep you out of the hospital, keep you from dying of ketoacidosis. All right? Your sugar may be too high and cause you to lose too much weight, or to have excessive urination or thirst. Type 1.5 diabetics, I will give a little bit of long-acting insulin to control their weight loss, because they can lose a tremendous amount of weight, and to control their urination and their thirst, because this can be troublesome. So you get a little shot at night, 5-10 units of Lantus, and they're taken care of. But you're not type 2, you're type 1.5. If what you described to me is correct. You're trim, you eat the diet, and your sugars are still up. You don't make enough insulin. Not so bad that you're classified as type 1, where you have to have insulin. It's deadly if you don't.
Thank you. So you gave a great talk last week on Chef AJ's show about the kidneys, and you've gotten a lot of response from that talk. Someone wrote in, Emmy wrote in, that last December, her urine test showed protein. She's lost about 40 pounds since following the McDougall diet, but is wondering what could be causing protein in her urine.
Well, there are lots of things, mild infections. Some people have orthostatic albuminuria, which is where they stand up and somehow or another protein ends up in their urine. But it's a common reflection of damage to the kidneys, and commonly diabetes damages the kidneys. But so do autoimmune diseases, glomerulonephritis, nephrotic syndrome, and you have protein in the urine because it leaks into the urine. So you have to decide whether you have kidney trouble or not. And the best way to do that is to get a BUN and a creatinine level, a cheap blood test, $5, $10, really inexpensive. So a BUN and a creatinine, and these are things that go up when your kidneys aren't working well. But BUN is blood urea nitrogen. So when you eat protein, beans, etc. When you eat protein, what happens is, because you don't store it, it has to be processed in the liver. The liver turns protein into nitrogen product called blood urea nitrogen from the protein you eat, and also a protein that breaks down your system. And it's excreted blood urea nitrogen by the kidneys. If the kidneys aren't working well, the BUN goes up. Creatinine is made by the muscles. It is a substance, it has an amino acid, like a protein, doesn't matter. Creatinine is also a product of the muscles. And so it's excreted by the kidneys. So if they don't work so good, then the creatinine levels up. So that's how you tell you have kidney disease. But, having protein in the urine is a suggestion that something may not be right, but there are lots of conditions where nothing's wrong, that you have protein in the urine. Nothing serious. Glad,
Okay.
congratulations on losing 40 pounds. I bet you
know,
got rid
right?
of any hint of diabetes you ever had.
Next
And you reduced,
question. Oh,
and you reduced your risk of breast cancer and colon cancer and prostate cancer if you were a man. You've done a lot of good things just by this one maneuver.
can you tell us why someone who's following a healthy, whole food, plant-based diet would still be getting hot flashes?
Oh, yeah. That I would expect, if you were raised on the Western diet, that when you go through menopause, because when you're on the American diet, you run bizarre estrogen and other female hormone patterns. And you develop a lifetime of elevated estrogens. And then you go through menopause, whether you're on our diet or not. If you're on our diet, you go through menopause at age 48, usually. If you're not on our diet, you start menopause at age 50 or 52. When you go through menopause and your ovaries stop producing estradiol, an estrogen, powerful estrogen, then you precipitously drop your estrogens, and that's what's believed to give you hot flashes. Whereas if you've eaten a good diet your whole life, when you go through menopause, the drop is much milder, much less precipitous. Now, why do I know this is the case? Because hot flashes are a problem of women who eat the Western diet. Why do I know this is the case? Because I've learned through the scientific literature and through my two close relatives who are Japanese, who speak fluent Japanese, and so do their mothers, that there's no word in the Japanese language for hot flash. Or at least there wasn't. Now the Japanese women, they eat the Western diet, and so there's got to be a word now, but there wasn't. Why? Because Asian women eating a diet of 90% rice didn't have a menopause like American women do. They don't go through withdrawal. They don't suffer these hot flashes and all kinds of other things that go along with menopause. Feelings of poor well-being. This is another problem of eating the Western diet. Now it's your job to find out a Japanese speaking person who was alive in the 1950s and 60s and ask him if there's any word for hot flash in the Japanese language. Report back to us.
Thank you. Okay, next question. This is from Carl. Is left ventricular dysfunction reversible?
A little bit. What you're talking about is the left ventricle, which is the big chamber. On the top, you've got your atriums. On the bottom, you've got your right and left ventricle. Your left ventricle pumps the blood out through the body. Really important pump. It can get, the walls can get enlarged, and the walls can become weakened. You have left ventricular failure. If you take the afterload off of the system by opening up the blood vessels, then you decrease the work of the heart. And so it can pump more effectively, and it has less stimulus to grow thicker heart muscle because you've opened up the capillary bed. Where if the heart has to do the work against, the strong pressures, the faster beats against this peripheral bed, which is your arteries and your veins, your arterioles and your capillaries, if it has to push blood into a system that has a lot of resistance to it, because it's all plugged up, which it is from eating the American diet, then the heart has to work extra hard. Open that bed up. What do you do to open the bed? You stop the formation of new plaques. In other words, atherosclerosis. In other words, the thing that bypass surgeons operate on. So you stop that, you reverse the plaque disease that's reversible. You stop the sludging of the blood, which occurs after you eat fat. The blood all sticks together, the oxygen content in the blood system drops 20%. You stop the spasms in the arterioles that occur as a consequence of eating oxidized cholesterol. That's one of the culprits. So you stop the sludging, you stop the blockages, you stop the spasms, you open up this huge bed, and now your heart has a little bit of back pressure to pump into. What would you think would happen to the heart muscle under those circumstances? Yeah, it would improve, but will the heart muscle come back to its normal state? No. Heart muscle cells do not replicate and repair. Once you damage heart muscle cells, they're dead. They don't regenerate. Like in your liver, you can kill most of your liver and it will grow back. Not the heart muscle, not the brain. It doesn't grow back either. So you got to realize that the damage that's been done, it's going to stay there. The workload you can change. I just showed you how.
Okay, thank you. Next question. How can we get, this is from Outlook Positive, how can we get enough biotin through a starch-based diet? Keep hearing that biotin is not adequate if you don't eat animal products.
I'd have to look at how much biotin's in there. I'm sorry, it's not a daily thought on my mind.
What
Don't
is
worry about it.
No, I would have to look it up. But my guess is that there's either loads of biotin in plants or the body takes some kind of plant material and turns it into biotin. Because people have lived.
Look, they sell it.
Oh, they sell it. But I wonder if that has anything to do with it.
Of course they do.
It's a B vitamin.
It's a B vitamin. Look at that.
Look,
All
all
of them all. There's
yeah, but
hundreds of
those are
them.
bottles of them. I'm looking at the plant. All B vitamins, except B12, are made by plants. Okay, there are 13 recognized vitamins. One is not a vitamin. Okay, 11 of the 13 are made by plants or by a bowel bacteria that digest plants. 11 of the 13. One of them is not a vitamin. It's called D. It's a hormone. It's not a vitamin. Why do I say it's a hormone? Well, vitamins are small organic materials that you have to get from outside, from the environment, from the food. That's vitamins, vital amines. So hormones, however, are small organic substances that you synthesize in your body. D, you synthesize in your body. D is a consequence of the ultraviolet radiation from the sun shining on the skin. And in the skin, sterols, like cholesterol, are converted into vitamin D, which is metabolized in the liver and the kidneys to make the most effective form of vitamin D. It's hormone D, if properly discussed. It's made by the body. And the other is B12, which is made by bacteria, which is a whole long discussion, which we're not going to get into unless you want to. So, biotins, it's got to be in the plants or derived from bacteria that eat plant stuff, bacteria that live in the colon. What did you find?
It says it metabolizes carbohydrate, fats, and amino acids, the building blocks of protein.
I was say the source. Why don't you look at the source of biotin? Anyway,
It doesn't say, yeah,
got me there, folks.
source.
Okay, next question. This is from Nina. How do you treat autoimmune hives? I have Raynaud's and EM. I'm not sure what that is.
Eosinophilic myalgia.
Wow.
Eosinophilic myalgia. That's what it is. EM is eosinophilic myalgia.
And that is?
That makes sense. What is that?
I'll tell you about it if I can remember. But I want you to know that they find biotin in bananas. So right here on our phone. Phone never lies. Says
It comes in eggs, milk, and bananas.
well, but bananas got other plants. The only reason eggs and milk have it is because chickens and cows ate plants.
Naturally present in some foods.
Yeah,
Okay.
it's made by just more plants than just bananas. All plants make it. Okay, the question was EM and Raynaud's. Is that correct, Heather?
And autoimmune hives.
Okay, so we got three. They want three answers for one.
One question.
All right. Well, Raynaud's is a disease that I can't solve. I've tried all kinds of people who I know do a very, very, very strict diet. Still, when they reach their hands in the refrigerator, their fingers turn white and blue because the blood vessels they squeeze down. It's called Raynaud's phenomenon. I don't know of any treatment. I don't know of any diet. I don't know of any supplements. I don't know anything to help it except to keep your hands out of the refrigerator. Eosinophilic myalgia, it was a consequence of feeding tryptophan supplements. Back in the old days, we used to sell supplements, tryptophan, to treat depression. And then the drug companies, I may have this story wrong, so I shouldn't even tell it. But this is all what I remember. This is like 40 years ago. Give me a break. Anyway, people developed, you're going to look it up, right? Put me in my place. Eosinophilic myalgia developed as a EO.
I can spell it, just
All right.
come on.
Anyway,
There, eosinophilic.
look
esophagitis.
plus tryptophan. What in tryptophan?
Just look up
No,
this.
eosinophilic. I see. All right, can't help my help here and talk to you at the same time. So we'll just talk to you. Anyway, the next question was autoimmune hives. Well, autoimmune diseases are discussed in detail in a lecture that I have up on YouTube. You look up McDougall and autoimmune diseases. Autoimmune diseases are due to a natural phenomenon that occurs when you eat foreign body parts. Foreign body parts are things that you get from the slaughterhouse. They're the parts of animals that they don't serve as muscles. You see, the first parts they take off the cow or the pig are the muscles. And then what they do is they take the remainder of the parts of the cows and the pigs and they grind them up. The thyroid glands, the spleens, the livers, the testicles, the lips, the tails, skin. They grind them up and they turn them into what? Into hot dogs, sausages. So you eat these foreign animals, and what happens? The body recognizes them as foreign. So it makes antibodies against them, but because you're an animal, just like the animal you ate, you're an animal. It gets confused and it does something called molecular mimicry, where it ends up attacking the foreign foods that you ate, pigs and the cows, etc. And then it ends up attaching to body parts and attacking body parts of yours that are similar. Like, how do you get autoimmune thyroiditis? Which, basically, if you have thyroid disease, you've got autoimmune thyroiditis. That's the major cause of loss of thyroid function. Why your doctor, every doctor will tell you, it's autoimmune thyroiditis. It's due to your own body attacking yourself. Now ask the doctor the next question. Why does the body attack my thyroid gland? Sounds stupid to me, doc. Why would my body do this? And if the doc knew what I just told you, the doc would say, well, you've been eating foreign thyroid glands. You've been eating pig and cow thyroid glands. And so the body recognized them as foreign, but it found your own thyroid gland, which was similar, and it attacked it and killed it. That's what the doctor might tell you if he thought like I think. But there's a whole lecture on that, autoimmune diseases and McDougall. Just look it up on YouTube. What'd you find out? Did you put tryptophan in there?
No, I didn't find tryptophan.
Well, you
It
didn't
just
put
said there's
tryptophan
no
in?
standard of care.
Put tryptophan in.
Okay.
All right, next question.
Okay, so we were actually asked this question in chat this morning during our course, but Dina is wondering if nuts, seeds, and avocado and tofu increase cholesterol.
I'm sorry, I got so excited about the synthetic supplement ingredients, L-tryptophan or 5-HTP, can cause eosinophilic myalgia.
You were right.
I haven't heard about this in 30 years, but I got it right, folks. Now, can tofu raise your cholesterol?
Well, high-fat plant foods like nuts, seeds, avocado, tofu.
No, they can't. You used to be thinking that coconut did, because coconut is high in saturated fats. But the evidence that coconut, high in saturated fat, causes heart disease is really non-existent. or even raises your cholesterol. There's an article I wrote, it's in 2006. You'll find it on my newsletters and my website. I wrote a whole article on this subject. On coconuts, because coconut oil, you could treat anything with coconut oil, right, folks? Just look at the internet and look at the sales for supplements. You could treat hair loss, you could treat fungal infections, you could treat cancer, you can treat anything with coconut oil.
You can even cook with it.
Yeah. Well, coconuts have the hardest shell of any nut that I'm aware of. You try and open a coconut. I'll give you a hammer. Try and open a coconut. That's a lot of work. It's wise. I think Mother Nature wanted to keep the ingredients locked up very tightly, so you didn't get too much fat or saturated fat.
Yeah, they're hard to open.
They're impossible to open. I know. You just have to go to the store and you buy a bottle and a lid on it. And it's got coconut in it. I don't have to crack the shell at all. And go for it, folks.
You need a whole jar.
Oh.
Okay, next question. This is from Kim's Happy Place. Does oil damage endothelial cells?
Yes. Omega-6 fats do. This is a work, it was published in the British journals. I think it was the British Medical Journal. It could have been the Lancet. What they did is in the 1970s is they set up some experiments. Ansel Keys had already come out and said that animal fat, meat, cheese, et cetera, cause heart disease. And so the inclination of scientists that way would be to just get the animal fat out of the diet. And of course, nobody would eat a low-fat diet, so we got to put some fat in it. So they put in vegetable fat. Specifically, they use corn oil, which is high in omega-6 fats. Okay, so the experiment done in the Finnish hospital study and the veteran study, these are institutions where they had a population that was under one roof. They controlled everything they ate. Okay, so they put them on these high corn oil diets. And back about 5 years ago, the British journals published the results from the 1970s of these men who, I think it was all men, who ate in this experiment, switching animal fat to vegetable fat, corn oil. And they found that they had worse atherosclerosis, more artery damage than those who stayed on the animal fats. So yeah, vegetable fats can be very toxic to the endothelial cells. Yeah, you need to you need to eat your fats in their original containers where they're protected by vitamins and minerals and fibers and phytates and the original packages. They're called oranges, bananas, rice, beans, maybe nuts and seeds and avocados. See, they're the fat and oils all protected by its environment. When you free it up and you leave everything else behind and you make it a bottle of oil, it's toxic. It's poisonous. Don't eat it. Unless you want cancer and heart disease, then you can eat it.
Okay, thank you. Next question. This is from Pare. Can LPA be helped by your program? My face and hands are darkened by the sun.
Try that one again. LPA is lipoprotein A, which is something you measure when you measure lipoproteins or cholesterol. Try this one.
Something else.
That'll be something else. What is the what are you talking about?
I don't know. I'll have to do some more research. We'll save that for next time.
All right. When you talk about lipoprotein A and B, it has to do with
protein.
It has to do with cholesterol. It's a subfraction of cholesterol. So I don't know what's related to the skin. I don't have any idea.
Okay, thank you. Next question. Have you heard of the Ketoflex program? It's a modified keto diet that uses whole food, plant-based foods. So I don't even know what that would be.
Nuts and seeds and avocados.
Could you make your whole diet out of that?
I don't know. Well, if they're going to eat no carbohydrate, because to be in ketosis, which is a condition of sickness, to be in a ketosis, you have to eat less than, I think, 50 grams of carbohydrate a day. In other words, 200 calories of carbohydrate a day. to go into ketosis. So to do that, how else are you going to do it? There's so much carbohydrate in your starches, vegetables, and fruits that they can't be part of your diet. Avocados are 90% fat. They're just a little bit of carbohydrate. Or you'd have to feed these fake foods like soy hot
I was gonna
dogs,
say that if you ate all that, all the fake
Yeah.
chicken and fake fish
Yeah.
and fake meat.
fake burgers, and made of isolated soy protein, where it's 70% protein, you could probably get the carbohydrate content down low enough to be on a keto kind of diet. You don't go into ketosis until you've gotten rid of all your carbohydrates, because the body loves to burn sugar. So when you get rid of your carbohydrates, say you're starving to death in a community, say your village is starving to death. The first 2 or 3 days are horribly painful from starvation, but you got 60 days before you die from fat deprivation. So after the 3 days of pain pass, you go into ketosis, which suppresses the appetite. So you can think of something else besides starving to death. You can plan on getting yourself out of trouble. That's one of the natural circumstances ketosis occurs. The other natural circumstance is when you become seriously sick, ill, say like from a bad flu or a cancer or whatever. You stop eating, and after a couple of days, the painful hunger drive goes away because you go into ketosis. You start burning fat because there's no sugar around. And a byproduct of fat is ketones. But see, when you're sick, you're supposed to be recuperating. You're not supposed to be gathered and preparing food. So what the keto people do is they simulate either starvation or sickness. They are what I call the make yourself sick diets, because that's how they work. So I don't know how you create a vegetable make yourself sick diet unless you go to something like nuts, seeds, and avocados and fake food.
Well, even the fake foods, I think they have too much carbohydrate in them.
Most of them do.
Yeah.
Remember, 50 grams of carbohydrate, and you're out of ketosis. 200
Okay, thank you. Let's see. I thought there was another comment I wanted to add, but I've lost it now. So many questions are coming in. Let's see. What would you recommend if there was one starch that you had to eat every day for breakfast, lunch, and dinner? What would it be?
Sweet potatoes.
I knew
I
you
would eat potatoes. I would have you eat sweet potatoes. It's just because
were gonna say
I love potatoes, and they're so low in protein. They won't hurt my body with all that extra protein. Protein, you never find deficiencies of protein. It's excess protein does terrible harm to the body because it's a burden. So they're low in protein. Sweet potatoes are even lower in protein. Potatoes are 10% protein. Sweet potatoes are 3 to 6% protein. Why would I want you to eat sweet potatoes? Because they're the most perfect of all foods that I can find. I get rid of potatoes because you develop solanine poisoning in potatoes, regular white potatoes. You don't with sweet potatoes. Yeah, I'd pick sweet potatoes for you. I'd go for white potatoes. But you'll do great on rice. You'll do fine on wheat, whole grain pastas and breads. And, you don't want to have too many beans in your diet. Just, a half a cup or a cup a day cooked is enough.
But with sweet potatoes or potatoes, you could just eat those
Yeah,
with no other vegetables or fruit.
yeah, you could just that in water.
But
You asked one food.
Oh, one food. You can't just have rice.
No, you can't have what I call above ground storage organs. In other words, the energy is stored above the ground, dirt. Above ground storage organs are things like they're called seeds. They're grains and legumes. They grow above the ground. Those you have to add a source of vitamin A and C, which would be a fruit and vegetables. Below ground storage organs, growing under the ground, below ground, potatoes, sweet potatoes, tulip bulbs. Remember we talked about in World War II, the people in Western Europe, because they were so desperate in Holland, they lived off tulip bulbs.
I can't even.
So there are bulbs and corns and potatoes and sweet potatoes. All these things grow underground. They give you everything you need except B12. And then if you don't wash off the potatoes very well, you'll get the B12. So.
Sounds good to me.
Yeah, was that the whole answer?
Yeah, I think so.
All right, we'll quit.
One food.
Yeah. And anyway, add the fruits and vegetables, you're going to live on above ground storage organs. Below ground storage organs, you can live on sweet potatoes and potatoes alone for years. You'd be fine. In fact, if you're not, write me, because I'd like to be able to report your case of efficiency, because it never occurred before. We could be famous.
Okay, another question about cholesterol. Can weight gain increase your cholesterol?
Depends on what you eat to gain weight. If you gain weight eating meat and cheese, yeah. If you gain weight eating vegetable oil, no, it'll go down. Ancel Keys' formula for elevation of blood cholesterol, Ancel Keys, he's the guy who did the K rations. He's the guy that I talked to you about, did the Minnesota starvation experiment. He's the guy who did the 7-country study. Ancel Keys did a formula which predicts what will happen to your blood cholesterol based upon polyunsaturated fat versus saturated fat, and then adding cholesterol to the equation. When you have a lot of polyunsaturated fat, your blood cholesterol goes down. A lot of saturated fat or animal fat, okay, polyunsaturated vegetable fat, animal fat, saturated fat. If you have enough vegetable fat, your cholesterol will go down precipitously. That's why they did the Finnish hospital study, the veteran study, where they switched people from meat and dairy to corn oil, like I just talked to you about, because that causes the cholesterol to go down, which they naively thought was the whole answer. And when they analyzed the effects of feeding that kind of oil to people 20, 30 years later, they found out it was toxic to the arteries.
Okay, thank you. We've got 2 minutes, but I'd like to get to this question. This is from KS. If autoimmune diseases are just about reacting to eating animal products, why do people also talk about giving up gluten? Can you answer that quickly?
Yeah, that's an easy one to tell you about. When you watch the lecture, McDougall and Autoimmune Diseases from YouTube, you'll see me to tell you about that. Well, most of the time when you eat the proteins, animal or vegetable protein, is that they are digested thoroughly in the intestinal tract so that they don't have any antigenicity. In other words, they're not something anymore that the immune system reacts to. Most are fully digested, but some people have a leaky gut. Like if you are sensitive to gluten, wheat, barley, and rye, really sensitive, you develop a condition called celiac disease, where your brush border of your bowel is knocked down and you develop a leaky gut, which allows intact proteins to get in your bloodstream. These intact proteins your immune system reacts to. So if you eat the Western diet, you develop dysbiosis, which means bad bacteria growing in your bowel, which give you a leaky gut. If you eat wheat, barley, and rye, and have a tendency towards celiac disease, you develop a leaky gut. And you look up anybody with celiac disease, one of the things they tell you is you're at very high likelihood of autoimmune thyroiditis, ulcerative colitis, rheumatoid arthritis, because you've got a leaky gut. So that's how it fits in.
Perfect. Great timing.
All right.
Thanks, Mom and Dad, Dr. McDougall and Mary. That was great.
I see you next week, 5 o'clock, same time, Pacific time, 5 o'clock every Sunday night. Mary and I and Heather will be here with you to share with you. And we've doubled our listeners just in the couple of months we've been putting this show on. And so we're building an audience. You can help us. Tell your friends and relatives who are sick, who think there's no alternative. Just listen to the McDougall's a little bit. At least give what they suggest a try first. You always got the other doctors to treat you the regular old way. Give them a try first. And the McDougall program is available free on the website. We also do a lot of extra things for you. Particularly, we do the 12-day program, which we're running right now. And that's where our whole staff is fully focused on you and getting you well, taking you off your unnecessary medications, getting you out of trouble, getting you feel well for 12 days. All you'll be able to think about is us, because we'll be in your face. When's the next program, Heather?
July 14th.
All right. See you then.
Thanks, everyone. See you next week. Bye, Mom and
See you
Dad. Happy Mother's Day.
Thank you. Bye.